Hello, hello. Okay. So let us continue the Nash Therapeutics study streak and the remedy that Dr. Nash mentions after the magnesium group, especially after a remedy which is extremely sensitive to pain, MACFOS, neuralgic remedy. He mentions the remedy which is diametrically opposite of this remedy, which is opium. So, what does Dr. Nash mention about opium and what is it in it for us to learn? Let's go over and find out that Dr. Nash tells us that it is one of the most abused remedies in all schools of medicines. And the fact is that opium does not produce sleep, but it produces stupor. So once you understand that opium produces stupor, stupor is nothing but a kind of an, you know, unaware of what's happening around. You are in deep sleep or you are half asleep or half awake. It is that state. So that is the state of opium which Dr. Nash wants us to learn and prescribe for rather than to prescribe for something that is not indicated. Now, Dr. Nash tells us that opium produces narcosis, comatose sleep with rattling stertorous breathing, and there is red bloated face, eyes are half open, and there is a kind of skin which is covered with hot sweat. Now, why does this happen? This also is given by Dr. Nash. So you will find that this book, Dr. Nash's Leaders in Homeopathic Therapeutics, is not only a materia medica gem, but it also gives you insights, one liners into what is the pathophysiology of the remedy. And if you understand by reading between the lines of what Dr. Nash wants to convey, you are going to transform your practice. So, what is it that Dr. Nash conveys for opium? There is nothing but fullness of vessels of the brain and the head, which cause a paralysis or semi paralysis of the nerves, which help in breathing. So, the nerves which help in breathing are a kind of paralyzed or semi paralyzed by opium, and the lower jaw drops and the sweat glands are closed. That is why we have hot sweat. So, this is one of the very interesting remedies which is not correctly used by homeopaths as well as by allopathics. They give large doses, poisonous doses, to make a patient asleep or produce that state. And we give medicines based upon similia similibus curantur, but not sometimes in the right way. The main logic in using opium, what Dr. Nash tells us, is it is capable of banishing pain, or more specifically, rendering the organism capable of sensing pain. So it can be used in conditions where there is no vital reaction. Now, this is the concept of using opium in no vital reaction. Other remedies that we should use and we don't use, we use the similimum to the fullest potency, 1 m, 10 m, 50 m, but we get disappointed. We use intercurrents, we get disappointed. No cure is happening. Patient will not get cured. But have you tried the remedies which will invoke a reaction in the body? Remedies like opium, sulfur, laurocerasus, sorinum. These are the four remedies which Dr. Nash gives us to be indicated in conditions where there is no reaction or lack of reaction. Next is that opium has a paralyzing effect, which is what we saw so far: semi paralytic condition or paralytic condition. And this is also there on the intestines. The irritability is lost, peristaltic action is suspended, and there is no desire for movement. Thus, there are hard fishes, and the urine is also retained, paralysis of the fundus of the bladder. Or in extreme cases, there is involuntary stools and urine, because passage of stools and urine is regulated from the spinal nerves, and at times when the brain control is lost, the local nerves may sometimes work, or there is an irregular distribution of the nerve impulses. So, in such cases, opium will work where there is paralyzing effect on the intestines as well as on the bladder. Opium has delirious and wide open eyes, glistening face, red puffed up face, vivid imagination, exaltation of the mind, and nervous and irritable and frightened patient. And there is also a state where there can be twitching, trembling of the head, arms, and hands. And there could be jerking of the flexures, even convulsions. No doubt it is one of the good remedies which we should often prescribe in convulsion cases or as an acute in convulsions. The patient is sleepless with acuteness of hearing. So the first class of symptom Dr. Nash tells us, which we always see in all types of remedy indications, is the primary action of the drug, which is the way it should act. The secondary symptoms that we always see is the nature's effort in contrast to what the remedy was given. And if you are prescribing opium for irritability, spasms, or excitement cases, there should and have to be and must be a episode of drowsiness, stupor, or insensibility before these stages come. If we are giving directly on the basis of irritability, spasms, convulsions, excitement, then, and if there is no drowsiness, stupor, insensibility before the phase of excitement, irritability, spasm, convulsions, then we will be ought to fail. So once you understand what Dr. Nash wants to mention from the pathophysiology point of view, in many remedies he give this indications of the remedy from the pathophysiological point of view. And if you understand this, your job to prescribe opium or any other remedy becomes very easier. This is why leaders in homeopathic therapeutics by Dr. Nash must be studied, should be studied mandatorily by all homeopaths, whether you are beginner or you are professional. Next is what we will see is the next remedy will be Nux Mostarda tomorrow, and till then you keep following Homeosetu on WhatsApp, Instagram, Facebook, YouTube. There is an interesting announcement coming up very soon, and a lot of ways to study different homeopathic subjects and different homeopathic literature. So stay tuned and connected to Homeo Setu, and you're going to transform your homeopathic practice very soon in 2025.